السلام عليكم ورحمة الله وبركاته. اللهم صل وسلم على محمد وعلى آله وصحبه وسلم. Last review and read about adult acute bacterial meningitis from the Ministry of Health Pocket Manual of Emergency from Saudi Arabia, Ministry of Health. So, the risk factors for meningitis. What are the risk factors for meningitis? The age greater than 50 years. We are talking now about adult acute bacterial meningitis. So the risk factor, age greater than 50 years, upper respiratory tract infection, otitis media, sinusitis, mastoiditis. Age greater than 50 years, upper respiratory tract infection, otitis media, sinusitis, and mastoiditis. Other differential diagnoses, we have head trauma, recent neurosurgery, compromised immune system, and crowded living condition. So the risk factor for meningitis in adults age greater than 50 years, upper respiratory tract infection, otitis media, sinusitis, mastoiditis, head trauma, recent neurosurgery, compromised immune system, example resulting from human immunodeficiency virus, diabetes mellitus, asthenia, alcoholism, steroids, liver disease, malnutrition, malignancy, drug therapy, and the crowded living condition. What are the clinical presentation of the meningitis, bacterial meningitis? Headache and nausea, fever, altered mental status, neck stiffness, neck rigidity, carrying and bruising signs. Clinical presentation, headache and nausea, fever, altered mental status, neck stiffness, neck rigidity, carrying and bruising signs. The other signs, trapeze position with the knee and hip flexed, the back arched, and lordotic angle. At lordotic angle, the neck extended and the arms brought back to the support the thorax. Other signs, focal neurological deficit, rash, and arthritis. What are the differential diagnoses of bacterial meningitis? Have encephalitis, aseptic meningitis, intracranial abscess, metabolic encephalopathy, encephalitis, aseptic meningitis, intracranial abscess, metabolic encephalopathy. And now let's see the workup. The workup in acute adult bacterial meningitis. Complete blood count, chemistry panel, lactate level, blood culture, coagulation profile, CT, lumbar function. CBC, chemistry panel, lactate level, blood culture, coagulation profile, CT, and lumbar function. The management, pre-hospital and hospital. The management of bacterial meningitis in adults. Standard pre-hospital. Standard personal protective equipment such as facial mask, vital signs and mental status during transport to patient, administer supplementary oxygen, blood glucose check, Glasgow coma scale, 2 large bore IV cannula with normal saline, fusion, pain medication. So pre-hospital management, you should protect yourself by facial mask. Then the vital sign and mental status, oxygen, check the blood glucose, coma scale, 2 large bore IV, normal saline infusion, pain medication. In hospital care, how to manage these patients. Dexamethasone, empirical antimicrobial. Dexamethasone, empirical antimicrobial. Predisposing factor. If the age of the patient between 16 and 50, then the common bacterial pathogen is Neisseria meningitis, Streptococcus pneumonia, Haemophilus influenzae in non-immunized patients. Then the empirical antibiotic is vancomycin plus a third generation cephalosporin, age 16 to 50, vancomycin plus third generation cephalosporin. If the age more than 50 years, the common bacterial pathogens Streptococcus pneumoniae, Neisseria meningitis, Listeria, monocytogenes, aerobic gram-negative bacilli. Then the antimicrobial will be vancomycin plus third generation cephalosporin and ampicillin. Age more than 50 years, vancomycin plus third generation cephalosporin and ampicillin. Immunocompromised system. In immunocompromised patients, causative agents commonly Listeria monocytogenes, aerobic gram-negative bacilli, Streptococcus pneumoniae, Neisseria meningitis. Then the drug is vancomycin plus third generation cephalosporin and ampicillin. So the treatment in the age more than 50 and the immunocompromised patient is the same drug, vancomycin, third generation cephalosporin, and ampicillin. In cerebrospinal trauma patient, then the causative pathogen Staphylococci, aerobic gram-negative bacilli, Streptococcus pneumoniae, and the antimicrobial vancomycin plus either third generation cephalosporin with anti-pseudomonal coverage or meropenem. So the disposition, admission to hospital. This patient should admit to the hospital.